up with the long axis of the mother. We then scan systematically up and down her abdomen, taking slices lengthways. Transverse. We then rotate the probe through 90 degrees so it's in the transverse plane. This means the long axis of the probe is lying across the mother. We then scan systematically across the mother's abdomen, taking slices crossways, giving left to right images. Sagittal. Sagittal is used when describing a vertical slice or view of a section that passes through the mother or fetus from head to foot. Coronal. Coronal is used when describing the view of a section that passes through the mother or fetus from left to right. Anterior and posterior. If we're considering the anteverted uterus and are scanning in both the longitudinal and transverse planes, then the anterior part of the uterus is the front of the uterus, nearest the mother's belly button, and the posterior is the back of the uterus, nearest the mother's spine, as an image uppermost on the screen, and the posterior part is represented on the lower part of the screen. Superior. This refers to the direction of the mother's head. Inferior. This refers to the direction of the mother's feet. For example, if scanning the uterus in the longitudinal plane, the superior part of the organ is the end towards the mother's head, and the inferior part is the end towards the mother's feet. As a scan image, superior is represented to the viewer's left on the screen, and inferior is represented to the viewer's right on the screen. Cephalic presentation. Cephalic describes the fetus in the head-down position inside the uterus. The head of the fetus is at the birth canal, in other words, just above the pubic bone. Breech presentation. Breech describes a fetus with its breech or bottom lying close to the birth canal, just above the pubic bone. Probe orientation. There is a marker or a dot located on the ultrasound probe, and it is always represented on the screen in the same place, usually the top left-hand corner. This dot is crucial when working out the orientation of the organ or the fetus, and when interpreting the corresponding image on screen. If the probe is placed on the mother's pubic bone in the longitudinal plane, one must consider where the dot is on the probe and relate it to the dot on the screen in order to interpret the image. In the longitudinal plane, the left side of the screen represents the superior part of the mother, and the right side represents the inferior part of the mother. So when scanning in the longitudinal plane, the mother's head is represented to the left of the screen and her feet to the right. The location of the dot on the screen should correspond. When scanning in the transverse plane, the image on screen is like a mirror image. The left side of the mother is represented on the right side of the screen, and the right side of the mother is represented on the left side of the screen. Again, the location of the dot on the screen should correspond. Understanding